Good afternoon. Welcome to Day by Day, the TV channel for FM CFS Canada based here in Ottawa. Today we're going to have a discussion with Jeanette Blier. Jeanette Blier is a registered massage therapist. Good afternoon, Jeanette.
Good afternoon, David.
Jeanette, we often hear about different modes of therapies for people with chronic pain, with chronic fatigue syndrome, and we see in studies that massage therapy comes up quite a bit. So my first question for you is, when people see or want to go to a massage therapist, should they look for people who've got qualifications? Do they have some registration process? I mean, what are your own qualifications? How do you think about this?
Well, here in Ontario, you're relatively safe because we have a pretty strict governing body, the College of Massage Therapists of Ontario. And they oversee massage therapy for all of Ontario. In Ontario, you cannot practice or call yourself a massage therapist unless you are registered. And that means that you've studied a minimal amount of hours, that you have taken a governing body's exam, and that you are registered and have insurance.
Okay.
Now, with that insurance and that registration, you also have to keep up a minimum of continuing education units on a regular basis.
Okay. Now, you've said to me before, we know each other from other situations, but you've said to me before you do treat some people with fibromyalgia. What kind of treatments are best suited for people with, say, for example, fibromyalgia?
Well, definitely massage helps, because with fibromyalgia, you've got an autoimmune system kind of dysfunction going on.
Okay.
And it's the nervous system that kind of reacts strongly, attacking itself. And, well, people with fibromyalgia kind of become experts on their own illness, so I don't need to explain that. But they can come to see me for massage, and a lot of people find that really, really helpful, as long as your massage therapist is careful of what each individual needs, because every person is different. But a lot of people find great benefit in craniosacral therapy.
Oh, okay.
And I can explain to you, if you'd like, what that is or how that helps.
Yeah, I mean, there are lots of different modes of massage. I mean, I know personally I've had people digging their elbows into me, and as a person who suffered from FM, I find that unbelievably painful, and it doesn't really, for me anyway, help a lot. And I think on the other side of it, something that makes my body relax and relax the muscles seems to work very well. So is that what craniosacral can help a patient with?
Very much so. The reason why craniosacral is almost magical with conditions such as fibromyalgia and chronic fatigue is because we live in a world where it's race, go, and with fibromyalgia you can get so much pain with that added stress. In a craniosacral treatment, you're finally getting into that autonomic nervous system, the part that is relaxation. So you'll actually kind of relax even your breathing, and get to that point in your body where your body can rebalance its energy and come back to that nice homeostasis point where your body can heal itself a lot better.
Okay. Do you find people fall asleep when you're doing these kind of massages?
This room has a lot of snoring happen in it.
So, I mean, I've heard also of things like lymphatic drainage. I mean, people with FM often suffer from what I can only say is kind of clogged up bits and pieces of facial tissue and stuff like that. I mean, is that something you practice too as a massage therapist? You do those types of things?
Yes. I've taken courses in lymphatic drainage and find that it really helps people with fibromyalgia, because we can pool toxins in certain areas of our body, especially if we're kept from moving the way we used to, perhaps. Lymphatic drainage does just that. It helps the body to eliminate the toxins so that you're in a healthier state. Yeah,
I mean, I find that with the muscular pain and the body guarding itself at times traps things, right? And so unless you can get some help to relieve those trapped things, then obviously you end up with feeling like you've got a bad throat or stuck nose or sinusitis. I mean, in fact, what you got is just trapped mucus and stuff like that needs to be freed up. When patients come for a massage therapy, what should they expect? I mean, how long should it be? How do they prepare for it, and those kind of things?
Well, most treatments vary between an hour to an hour and a half. Certain people like to have the full length of treatment, so they request an hour and a half. Other people come more frequently, and an hour can be enough. It really is a matter of discussing it and finding out also in the assessment what the person needs. So an hour to an hour and a half is the more common.
Okay.
In order to... Sorry.
Do you keep sort of records of patients? I mean, do you keep track of how they're progressing, and is that one of your requirements?
Absolutely. As a registered massage therapist, we are required to keep medical documents, medical files.
So you keep up to date with medications and all those kind of things?
Yes. The health history form that a person will fill out the first time they come in has to be renewed every year. The person has to look over their form again and write down if there are any changes. As well as the person is coming, you're keeping a record. So, for instance, if you were to come and say, well, my doctor started me on a new medication, I would right away put that in your file. And we're governed also by the same laws as your doctor. After you've stopped seeing your massage therapist, they are required by law to keep those files for a whole 10 years.
Okay.